Welcome to Youthtopia Unite Day 3! Yay! My name is Tasha. I'm the part of Youthtopia team and I will be hosting this webinar tonight. And I'm not alone here. I'm with my co-host, Natasha.
Hi everyone, I am Natasha Tanhutko. I'm from the Philippines. So welcome to Youthopia Unite's Day 3. We're so excited to have everyone here as changemakers. I am from Tayo. I'm the co-founder as well as Kids for Kids Philippines, and so excited to co-host today with Tasya.
Yay! Okay, we're having two Tashas at the moment, and we're having ladies' night. We will introduce you our awesome speakers. Natasha, would you please give us a little bit brief explanation about the SDG number 3, good health and well-being?
I would love to. So, for everyone's benefit here, today we'll be talking about SDG number 3, which is good health and well being, which is very essential to sustainable development, as we all know. But sadly, according to the United Nations Development Program, the world is off track to achieve the health related SDG because of the COVID-19 pandemic and much more. Uneven progress to both between and within countries is also evident. I guess there's a 31-year gap between the countries with the shortest and the longest life expectancies. And with that, those are being so many people being left behind, people being overlooked. And therefore, we realize that this issue that we're having is very multi-sectoral, and it's also right-based as well as gender sensitive, and it is so important to take these to address all our health concerns, our health inequalities, and to build good health and well-being for all. Coming from a third world developing country, we really see how health is something that affects really not just the person but entire communities and later on the environment as well. So excited to see how this discussion plays out with everyone.
Wonderful. And so, to discuss this, what real-world solutions are needed to accelerate the change to achieve these goals, SDG goals number 3, I would love to welcome our speakers. Please introduce yourself one by one. We're going to start with Dipika, Sasha, and then Stephanie.
Hello, namaste, and warm greetings to everyone. I am Dipika Badal, 22-year-old youth activist from Nepal, and I'm currently working as the president at We for Change, which is a youth-led organization entirely led and governed by young people of 16 to 24 years of age. And we believe in youth power and have been providing platform for young people to enhance their leadership skills by working mainly in 5 different thematic areas, which are youth leadership and livelihood, active lifestyle and well-being, environment sustainability, youth civic engagement for peace building, and disaster preparedness for community reintegration. And I'm really excited to be here today, and I'm looking forward to take away lots of learnings. Thank you.
Thank you, Deepika, for your brief introduction. Now, moving on to Sasha.
Great, thank you so much. My name is Sasha Wright. I'm 21 years old and I currently live in Montreal in Canada. It's bright and early here, 7 in the morning. I'm the Research and Impact Coordinator for Force of Nature, which is a social enterprise that exists to bring young people from a place of anxiety to agency. The lovely organizers at Youthopia were kind enough to reach out to my founder at Force of Nature, Clover Hogan. I'm currently in my final year at McGill University studying the ecological determinants of human health, which is essentially the confluence between global and planetary health. I remember my dad once describing that to me as being where mankind's 2 biggest problems meet. In my time at McGill, I've also been involved in research and leadership with Universities Allied for Essential Medicines, which is a student-led organization that works to improve access and affordability of medicines around the world, as well as research and development into drugs for neglected tropical diseases. I'm super excited to join you guys today.
We're super excited to have you guys as well. Now, last but not least, Stephanie.
Hello guys, my name is Stephanie Cecilia. I currently live in Jakarta, Indonesia, and I also work as a professional dentist and public relation hospital at UKI Teaching Hospital in Jakarta. And aside from that, I'm also the founder of Medical Talk and Communication, or you can call us Medication. It's an organization for health workers or prospective health workers to promote health education, especially for public and also rural areas. Apart from that, we also are an organization with an interprofessional collaboration to facilitate the achievement of integration, interconnection, and cultural revolution within healthcare system in the future. And I'm so excited to be part of Youthopia Youth tonight. Thank you.
Wonderful. Okay. Now there you go, our 3 speakers. And yeah, let's get started. Get your pen and notebook, your note-taking tools. Here I am, I have my notebook here. So, Tasha, shall we start with
Yeah.
our first questions?
Exciting. Okay, so let's begin our discussion. So, this webinar will really act as something very conversational, and that's what we really want to foster throughout this entire event. So, speakers, you can jump in when you want. If you don't feel like answering, that's fine. So, let's start off, I guess, with a really good introduction question. So, for all our speakers, what does good health and well being mean to you?
Who wants to answer first? Maybe Sasha?
Yeah, absolutely. Thank you so much. I think when I think about good health and well-being, for me, achieving that goal is certainly not the same as achieving the same health and well-being for everybody else. So I have different needs and I have a different context. But I think having good health and well-being is being equipped with the tools and the space and the ability to live authentically as yourself. So everybody's going to reach fulfillment in a different way, but good health and well-being is prerequisite to being given the opportunity to do so. And if we fail to recognize that our health and our well-being is interconnected with our communities and our countries as global citizens, with our planet and planetary health, and if we fail to promote the health of our neighbors as avidly as we promote our own, we are going to be vulnerable. So our health cannot succeed at the detriment of our neighbors and our planet. We all need to work together towards this notion of collective good health and well-being.
That's amazing. I really love that answer, how everything's interconnected. I feel like that's such a good thing we want to highlight here. So, any of our two other speakers you want to add? What is your, how does good health and well being mean to you?
Maybe Stephanie, adding a little bit your perspective.
Okay. Okay, for me, maybe because I work as a dentist, for me it's just a simple words. Good health and well-being means like free from disease, right? We need to be, like free from other factors who can disrupt or maybe destruct our bodies, and also maintain our mental health in a good way. I think it's all about balancing our lifestyle, balancing our behavior, and also balancing our mind towards a better version of ourselves.
Great. Yeah, balancing. I really agree on that. Again, we saw the answer before from our participants being positive, healthy, not just physically, but also mentally. So, balance. Now, Dipika, please share us your perspective on what does good health and well-being mean to you.
Yeah, they were great answers. So to add from my side, good health and well-being for me would be, providing access to all health and services, leaving no one behind, so that everyone will be able to have positive mindset and positive body.
Okay, nice. Now we have heard our speaker's perspective on the good health and well-being. What does it mean to them? Now, the next question is, I would love to hear three of you again, the status quo on the SDG number 3 in the world, especially in your, specifically in your country.
Okay, I can start. So SDG 3, I think, has been having its, own ups and downs. Whenever I think about SDG 3, I have a picture about two different scenarios, one before the pandemic hit us all and one after the pandemic. Because before the pandemic, there were many progressive advances which seemed to be encouraging, mainly talking about Nepal in the target related to maternal mortality, infant mortality, AIDS, as well as SRHR. And government had been able to, bring out positives and supportive policies, supporting new initiatives and advancing health systems. And also after the federal government system in Nepal, where we were able to have effective and efficient formation of health-related policy and decentralization. But after COVID-19 pandemic hit us all, as you said in the beginning, every progress has been, further off track. And there is rapid increase in case related to COVID, and there are significant loss of life, as well as many health systems having overwhelming throughout the world. And especially the conditions are very critical in countries as Nepal, where health system is already very weak. So the progress that Nepal had made in targets are likely to get worse due to the pandemic, and challenges may arise, mainly in sectors of healthcare and services, severely affecting all the progress made in maternal health, childcare, and and in this condition, we have been able to see, there is a significant uprise in problems related to mental health, such as there has been anxiety, fear. I personally also faced a lot of those. So before the pandemic, the scenario was a bit progressive, also in Nepal, but due to this outbreak, the progress has been really very paused.
Very unfortunate indeed. The COVID-19 really brought us back to square one in so many aspects. Deepika mentioned a little bit about the mental health that cases increasing. Sasha, maybe adding a little bit status quo in the world and especially in your country.
Yeah, thank you for calling on me. I feel very privileged to be able to come into this space from across the world and hear about your experience in other countries. And I would say that, you know, the generalized health outcomes are pretty promising for Canadians, although the system is not without its failings. We do have universal health care, wait times continue to be long. There are vulnerable people who always fall through the cracks. But I think where Canada struggles is in kind of seeing the system in its complexity and its complicity. And I see a couple main issues facing Canadians in achieving this goal of good health and well-being on a global scale. So the goal states ensuring healthy lives and promoting well-being for all at all ages. And I think in Canada, health is still promoted for a very limited scope of people. So our methods of healthcare encompass a we that is non-inclusive. Indigenous people in Canada suffer disproportionately from inequitable access to healthcare. First Nations and Inuit communities suffer massively from institutionalized, internalized, personally mediated racism. And, you know, even if you look at the statistics on the Government of Canada website, for most people in Canada, the risk of developing something like active tuberculosis is very low. But the rates of active TB among Indigenous people in Canada are 300 times higher than for the normal population. So I see that Canada has made quite a bit of progress towards this goal, but they do kind of continue to perpetuate the colonial roots of global health and its interface with its own communities and with the rest of the world. I also cannot pass this by without mentioning the prevalence of mental health issues, especially in children and adolescent populations. You know, notwithstanding the burden of care on mothers, fathers, families, educators, mental health issues are on the rise and they are a threat to our collective productivity as a society. And health can't just be the absence of disease, it has to be also the presence of wellness. And I think we need to reflect at this point, how are we failing to cultivate wellness in our young people? If we can't address this mental health epidemic, we're allowing a generation to struggle and strive against stagnation at a time where our voices are critical in the march towards progress.
Okay, interesting. Wow, I'm still trying to process the whole condition that is happening there. But moving now from Canada, we're moving to Indonesia. Stephanie, would you please share the status quo? What do you think about status quo in the world and also in Indonesia?
Yeah, when we want to talk about good health and well-being, you know, like during this pandemic, everything is chaos. I mean, like everything, like healthcare system, health workers, even people. Sometimes I feel like I feel so sad because whenever I work at the hospital, I've seen so many people who are not aware of the COVID-19 or health protocols. They don't use masks. They just go to the hospitals, talk to each other, and even they believe based on their faith, based on unlogical thinking during this pandemic, and it's getting worse. I've seen so many people who died due to COVID-19 actually are not aware because they have already a comorbid disease. And I think Indonesia, in my country, we are lacking of health prevention and also health education. So many people in Indonesia are not aware that they are actually they actually have a disease, but they're not eager to admit it. They don't want to go to hospital to check for regular medical checkup, or they don't just want to go to doctors or clinics. They're just afraid to admit that they are in not a good condition. So I think that in the future, maybe SDG number 3 will not just be about good health and well-being, but of course, good health prevention and also health behavior. Because I think it's useless because we already talk to community leaders, we already teach them to maintain the protocols, health protocols. Even I volunteered to be a COVID-19 tracer. We try to find a new case every day. We try to interview some people who might have a record for the COVID-19 transmission, but they won't admit it. There was no transparency at all in COVID-19 detection in my country. And because of that, I'm afraid that maybe it's not just about the COVID-19 system, it's not just about the government policies or protocols, but it's all about too many people in one area who live together, and they all just don't care about health behavior and health prevention. That's the most important thing. Of course, in the future, we have seen on television, we have seen on the news that the vaccine is getting closer right now, but I believe it's not just about the vaccine, because we need to maintain our health, our immune system to be balanced, and also to prevent any other communicable disease that might be in the future. So I think this pandemic is absolutely changing everything, especially in healthcare ecosystem. And I really believe that future generation, or probably young generation like us, will have a fundamental role to give more education and also to raise awareness for every person in our area about health prevention.
Sasha gave you an applause there.
Thank you, Sasha.
I think I have to agree that in several countries, we still have the mental health, the idea of mental health is still being taken as taboo, and also healthy lifestyle, maintaining a healthy lifestyle, as Sasha also mentioned, also is not important yet. So it's definitely, we need to go faster and we need to educate more people about it. Next question, Tasha.
I agree. I just wanted to say how amazing it was, even how different our backgrounds are from different countries. Like the same situations are happening all over the world, and that's how we really see how good health is interconnected no matter where you are. And that leads me to this next question, where we talk about what you guys think are the barriers that prevent SDG 3 from being achieved in time. And based off your experiences as young change makers, what have you seen kind of hinder progress in this certain sustainable development goal? So maybe we can start again with Diptika.
Well, being one of the developing country, there are many barriers in attaining SDG 3 in Nepal. So one of the most highlighted barrier that I would say is lack of infrastructures. It may be human resources, infrastructures, as transportation, communications. So this is being one of the most highlighted barriers. So regarding COVID also, we had to send the samples to Hong Kong for testing, for the first case that we had. It's because of the lack of the infrastructures, the resources that we have here. And the second thing I would say in context of my country is unequal distribution of healthcare services. So we have these three different regions: Sarai region, hill regions, and mountains regions, but there's no easy access to hard reach area for the healthcare services. And the most highlighted things about another highlighted thing about developing countries, lack of accountability and transparency in government system. So there is very lack accountability and transparency that leads towards being one of the barrier in attaining SDG 3. And also for common people, lack of responsive nature of those common people. We have always been habituated to blame that our government is not doing things, but we forget to look onto ourselves, what we are doing. We have been telling that climate change is a hoax, but climate crisis is one of the leading cause for many disturbances related to SDG 3. So I think these are some of the barriers that is leading towards attaining SDG 3 in context of Nepal.
Thank you so much for all of that. No, I completely agree. I mean, here in the Philippines is a developing country as well. Everything you said just completely aligned with the situation here. And it's crazy to think that even when it comes to other SDGs, how closely related it is to this one, like how you mentioned the climate crisis. And I feel like eco-anxiety is what Force of Nature also talks about, where Sasha's from something that talks about that. And I guess that's a really good perspective that we could see that we need to talk about intersectionality. So Sasha, maybe you want to take it from here.
Yeah, for sure. I really appreciate that answer. And I think, the 17 SDGs are incredibly interconnected. They have to be tackled together and considered not one by one, but as, an interface and a synergy between their various outcomes and causes. So SDG 3 cannot be achieved without considering the other goals. And when we think about health in the world and the development and the march towards this idea of good health and well-being, it is advancing, but so too at the same time is the gap in inequality. And I think this is often because the global health agenda, whether that's in climate, in healthcare, in systemic problems, it's decided by those who contribute to the issues the most, but it's decided for those who suffer the most consequences. So I think these systems need to be brought down and made horizontal instead of vertical, and people need to feel like they have autonomy and a say in their healthcare and in their rights to healthcare. And I guess above all, it kind of underlies the need to make progress on achieving this idea of more universal healthcare, which is essential to beating COVID-19, but also to just achieving all of the other targets. The number of people who spend more than 10% of their household income on healthcare is on the rise. And if those aren't the people who have voices in their own care, I think we're going to find ourselves in a dire situation where many are being left behind. So health is a moving target and it needs to be treated as such. And we cannot treat the diseases that have the greatest optics. The COVID-19 vaccine is incredibly important, and I'm definitely not discounting that at all, but you look at a disease like tuberculosis that, we're using the same treatment for TB as we used 100 years ago because it's not where the attention and the funding goes. So I think we need to start thinking about, who's not getting included in the discussion and who's getting left behind in our healthcare systems and how can we promote their voices.
I completely agree with that. Like the inequality in health is great. And I feel like that's something we need to realize all of a sudden is that a lot of people aren't anymore focusing on good health, but just trying to survive. So that's something we need to change because in order to really accelerate the growth of this SDG, we need to talk about the people that matter the most, those that are most affected. And I think we can go to Stephanie as someone who has understood the process of tracing COVID, can kind of give us a highlight on what barriers have prevented as well this SDG from progressing.
Okay, for me, it happened in my country. I think that the most barrier that I think it's really important to tackle, it's political affair, all about, again, political affairs. Sometimes when we are so close to get the cure of COVID-19, when we are so close to deliver a good distribution for healthcare access, or probably increase the tests in certain area, again and again, political affairs sometimes are in the power. And of course, so many, like my colleague, other health workers, healthcare staffs, we just don't know what to do because the regulation is not in our hand at that time. And again, I think it's very important for young generation to create change anything like contribution or movement or organization, because I believe the presence of non-profit organization or a movement, social movement, is really, really important to tackle the government regulation, because our voice sometimes have essential role to convince the regulators in order to make the updated regulation during the COVID-19 pandemic, because we are in the field, we know the situation, and we are very concerned about the problems as well. But again, sometimes our voice are hidden because of the political factors, and that is the most embarrassing thing that I must admit. I mean, maybe it's not just in Indonesia, maybe it happens all around the world, or maybe in some developing countries. But I must say, the presence of NGO movements or other young change makers, has a great contribution to convince the regulators.
Completely agree with that. It is political here in the Philippines as well. You really realize how it depends a lot on the people in power, where they decide to put that power. So completely agree with your frustration.
I've seen that, especially in hospital. I mean, it's a lot to say, but yeah.
I understand your frustration. Don't worry, we see it every day here as well with the way our country handled COVID-19. We have one of the longest lockdowns in the world. And so I guess that's something to kind of think about. And so I guess we can go to the next question, Tasia.
Touching a little bit on the SDGs as an overhaul, because as Sasha also mentioned, SDG is not just focusing on one point, it's all interlinked, 17 points. Do you think that there are some points in SDG that needs to be renewed? If so, which ones are those? Shall we go with Sasha first?
Yeah, for sure. I think when I thought about this question, I was impressed with the 17 SDGs and how comprehensive they were. And I think there were particular aspects of the SDGs that up to this point in development hadn't been kind of elucidated and materialized on their own. And so I was happy to see that good health and well-being, health and education for girls, climate action, zero hunger, all of those were kind of like separated and given their own bits of thought, but within those various targets, you can kind of see how they interconnect and interface with one another. One thing I will say about SDG 3 in particular that I noticed is target 3.4 is reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment and promote mental health and well-being. So while this is extremely important, I think in this particular aspect of the goal, mental health is kind of tacked on the end as promoting mental health and well-being. And for me, mental health is almost a precondition to good health. It's not something to be pursued once other health issues are addressed or cured. This fails to acknowledge that adverse mental health outcomes, just like any other health issues, they can often be the outcome of socioeconomic disparities and inadequate systems to both prevent and address these massive gaps in provision. And I think we need to start thinking like social workers when we address people, where each individual who comes presenting medical issues, they're not just a collection of pathologies and a bag of bones or a collection of outcomes, but they're a dynamic and important individual, and they're subject to myriad factors, which are both past and present, and they interact to produce their current situation. So mental health, physical health, environmental health, these aren't just ailments that can be treated exclusively. And when we think about healthcare, you can't just throw people the bulletproof vest. You need to start unloading the gun. So really looking at how we can start from a place of good mental health and promoting that as a main tenet of the SDG goals, I think is going to be incredibly important moving forward for both health and also just for productivity.
Wonderful. Dipika, I saw you nodding while smiling as Sasha was saying about the 3.4 goals. By the way, guys, I have all of these goals printed for me. Dipika, please share your thoughts on this.
Yeah, because I completely agree with Sasa. Whenever I was looking at the targets of SDG 3, I also thought about a 3.4 because very less priority has been given towards mental health and well-being, but it is one of the most rising problem in today's generation, right after the COVID pandemic too. And I completely agree with everything that Sasa said. And along with that, I think that a little bit higher focus should also be given towards young people and SRHR because it has also been much prioritized in the targets. And with the evolved thoughts and scenarios, and there are different concerns within and different questions, within young people about their body changes, sexuality, behaviors, and sometimes they might feel a little bit stigmatized of being, sexually active, or they may have different questions about that, and that might hinder their decision-making capacity. So all these things kind of make young people from, accessing informations, awareness about even SRHR services. So I think along with mental health, a little bit more priority should be given towards SRHR and young people too. But due to COVID, I think all the SDG 3 targets should be, worked on from the beginning. So I think this is my viewpoint on renewing some of the targets.
Yeah, COVID-19, circling back to the COVID-19 topic, there are so many things to talk about COVID-19 in the year of 2020, I believe. And again, circling back to Stephanie, who has also been working with it closely, I think, with the COVID-19. Would you please share if you have any thoughts on this as well?
I don't know. I have no idea. But for me, maybe the point number 1, because as you can see, mortality rate. I think by birth mortality rate, we don't know for sure about the cost, the cost that maybe we can get from the pandemic of COVID-19, because we need to get more research and then study further about the relation between COVID-19 and also the pregnancy women and also the mortality rate by giving birth. I think we need to take a look closer with that.
Okay, so it's the mental health and also mortality rate. Interesting. Two different points. Now, Tasha, can we move on to the next question?
Yes, so such amazing answers. I feel like everyone really has such complex knowledge in the SDG, which is so great. So, in your own perspectives as young change makers, how have you done your part in accelerating this SDG? Since we know there's a lot of fallbacks with this one. How you, as a person, and your advocacies have spearheaded initiatives, I guess, that accelerate change. So maybe we can start again with Diptika.
Thank you, Tasha. So one of the most prioritized thematic area that my organization works is active lifestyle and well-being, which aligns with SDG 3. So within this thematic area, our main focus has been in three major sectors of HIV/AIDS, SRHR for young people, and mental health. So the epidemic of HIV in Nepal is, very hot topic and is highly concentrated among migrant workers. So we have two projects that works on HIV and AIDS. So through Project Out Loud, we have been able to sensitize young migrant transportation workers about HIV/AIDS, provide them visitor services, and test their status on HIV. And one of the initiatives that I am very proud of personally is Free HIV Testing Bus, which is a very new concept in Nepal, where we have modified a van into mobile HIV testing clinic, which moves to most vulnerable and high-risk communities of Nepal and provide free HIV testing facilities. So this initiative started in 2018, and till date, we have been able to provide free HIV screening tests to 21,000 people and from 15 different vulnerable districts. And we have been able to identify 78 positive clients and link them to ART services. So this is what We for Change and I have been doing in the sector of HIV and AIDS. Also, from the beginning of my organization, we have always worked on young people and SRHR. So through projects that Say Yes to SRHR, Condom Song, Condom Festivals, we have been able to work with young adolescents and youths and aware them about SRHR, its issues, menstrual health and hygiene, and everything related to SRHR. So, and also one of the most important topic within SDG 3 that I personally feel is mental health. And for mental health, we have been working on project Let's Meditate, which aims to aware young people about the social anxiety, social and media anxiety disorder, which is one of the most overlooked issues in today's generation, because we as in young people are very much habituated to social media, and we forget about all the negative impacts that can bring to us. So through Let's Meditate, we are looking forward to work with young people in this issue and help them aware about this issue and also find some coping mechanism regarding it. So these are some of the few things that my organization and I have been doing to contribute towards SDG 3.
That is amazing. I really love how you kind of do a lot of breaking the stigma or like taboos within your organization. I feel like that's so important. And what young people have as a very unique trait is we really like changing the system, talking about turning around things. And this is really good, especially in the mental health sector, where all of a sudden, as you mentioned, social media is so important to talk about within its relation to mental health. And so maybe Sasha can kind of highlight that further with how she kind of connects mental health and the environment.
Yeah, thank you for calling on me, Tasha. And I teach workshops with Force of Nature, and I had Tasha in one of my workshops maybe about a month ago. So it's really lovely to see you again in this space. When I think about how I've accelerated change for SDG 3, I think that far and above my greatest impact has come from talking and listening. And often my impact has come from when I've chosen not to talk and when I've chosen to listen. And I think I've tried to come at good health and well-being from a number of angles in my life. I've struggled so hard to visualize it and understand it, materialize it. I think I almost forgot what it looked like. But at Force of Nature, we endeavor to create an open and accessible place for young people to step into their own unique forms of resilience and involvement in advocacy. So we don't purport to know the answers or tell people how to achieve their own well-being. we want to be a conduit for people to seek their own answers. So, you know, in our workshops, we talk about being scared, and we express uncertainty in each other and in the state of the world and in ourselves. And we breathe sighs of relief when we kind of can let down this facade and say, I am uncertain, I am scared. How are we going to move forwards together? I think I'm continually surprised, and we're all continually surprised when we find that fear and uncertainty are universal human emotions, and they transcend class, geography, culture. I think above all, we need to forgive ourselves for feeling overwhelmed, and we need to welcome mental health into the lexicon that we use when educating young people about how to take on the world's messiest problems, because otherwise we're dooming a generation to burnout. So I think I can draw on different aspects of impact, but for every conversation I have and for every young person I connect with in the workshops each week, I have a little bit of hope that I maybe have lent someone some oxygens, that their flame can burn a little bit brighter, and that they can go out into the world and continue to spread that.
That's so lovely to hear. Like, I really like how it's something super simple, but something that will really contribute and help people a lot. It's listening and understanding where they're coming from, and so they feel like they're not alone. I feel that's something super important, and people understanding how others feel like and contributing to their well-being as well. And so maybe we can get the last perspective from Stephanie and how she sees that this could kind of affect maybe in your area, in your sector.
Okay, so actually my contribution has come to me when I finished my school, my college, and I've graduated as a dentist, and I've seen the reality that was not like what I expected before. I've seen like so many health workers in my country, we're so full of profit mindedness, you know, like they gave the treatment to patient, but they work based on profit, not just by, you know, like by altruism to take care of humans or take care of each other in healthcare. And apart from that, I've also seen like inequality issue in healthcare ecosystem, especially from one health profession to other health professions, like doctors to nurses, doctors to dentists, doctors to pharmacists, and many others. And I've seen like this must be a problem that might have a huge impact in the future, especially in the healthcare culture. We cannot work like this because especially in developing country like Indonesia, we are lacking for health workers to collaborate between one another. And for some areas, maybe like rural areas, border areas, they are also lacking of health workers. So it might be an integral benefit for us to collaborate each other, and then to try to break the gap between us and try to build a bond, build a connection. And then after that, on February 2019, I started to create a simple forum group discussions to gather all kind of health professions together. And then I've noticed that when they work together, they can like solve the patient problem in a very effective way. And I think that I needed to enlarge my group. And then from that moment, I created a foundation called Medical Talk and Communication. So we are basically a health organization to unify health professionals and also future health professionals through advocacy, research, empowerment, and also collaboration. And every month we held regular discussions, especially during the COVID-19 pandemic, and then share each other's opinions about their experiences. And also we held health education movement in rural areas and also public. So I think that is what we need during the pandemic. We need collaboration.
I just want to say that how interesting to Sasha, your perspective also to really make people admit or accept to being afraid or to get really scared to acknowledge that feeling. Also, Stephanie, educations and also awareness on the good health and well-being. So interesting, very interesting points. Now we're kind of running out of time now. So I would love to encourage the participants to start asking questions, leave your questions. Can I ask Tias? Yes, for sure you can. Leave your questions in the chat sections, and our logistic teams will get back to you. Now, my next question would be, what are the 3 things industry leaders and world leaders should do? So what are their to-do lists from your perspective? Shall we start with Dipika?
I think that the 3 things would be listen, support, and act. So listen to the views, opinions, voices, or ideas that young people and change makers have. Support and trust their ideas, support and trust their goals and vision. And finally, act, not just promise or provision of universal healthcare or just formulation of policies, but act, implement, and actually make an impact. So this would be the 3 things that I would suggest the world leaders to do.
Now, Stephanie, what are your 3 top to-do lists for the world and industry leaders?
Okay, for me, maybe like passion, initiation, and action. Those are like my magical words whenever I felt like the ups and downs during my profession or my work in this organization. If we know how passionate we are and how first we initiate this movement, how first we initiate this foundation or organization, and we absolutely don't have nothing to be aware of because we want to contribute as much as we want. So that's the most interesting part throughout my journey, I think.
Shall we move on to Sasha now? What are the 3 top to-do lists from you to the industry leaders and world leaders?
I would say my top 3 would probably be to start with meaningfully engaging young people through mentorship for emerging leaders. We are the inheritors and the stewards of tomorrow, and we need to have a voice in what that's going to look like. We need to have a stake in it, and we need to start getting invited into the room to speak about it. I think along with that, my second point would be a concerted effort from power to redistribute, recommend, and pass the microphone to those who have not had it and who have not had the opportunity to speak. Ask who's not getting their voices heard. My third, from a bit of a step back and a bigger perspective, would be to stop categorizing health. It looks different for everybody, and context really, really, really matters in health. The promotion of good health and well-being needs to be pursued under the understanding there's no one size fits all when it comes to health, and each person has to be considered as an individual.
Great. So we have listened to the youth support because Sasha is just interlinking with Dipika's to-do list, I guess, to pass the mic for those who haven't had that before, and also to take the action. So not only speaking, but really to walk the talk, just like Stephanie has said. Moving on to the last question, Tasha.
And so we have our last question for a discussion. I guess we can ask, what are 3 things our audience can put on their changemakers to-do list to accelerate the change for this SDG? So maybe we can start again with Stephanie.
For this SDG, good health and well-being, start from yourself during this pandemic. Just follow the health protocols wherever you are, whenever you are, wherever you go, please use the mask and also keep your distance between one another. And please, eat well, maintain your health, exercise at least 30 minutes per day, and then drink more water, 7 cup of waters. And also, just meditate if you can. Maintain your health and also maintain your mental health, physically and mentally. I think that's my advice to you guys.
Amazing. Thank you so much for that, Stephanie. Now we can move on to Sasha.
Yeah, thank you very much. I really like the way that you said, start with yourself, start with you, because, that's what you have the most control over at the end of the day. And I think my first point would be to please, 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 please take care of your mental health, especially at this time. Check in with yourself and check in with others. Like I said, mental health is a precondition to good health. It's not something to be pursued once everything else is addressed. I think my second point would be to seek solutions in solidarity with instead of on behalf of affected communities. I can't restate this enough. The golden rule that I try to abide by in advocacy is centering the voices of those who are affected. So reaching out to those who look like they're struggling, making sure you're not speaking on behalf of people, and really just thinking about who's not getting included in the discussion. The third thing I I would say is probably to think about your health as an individual, but also as a global citizen. And I remember this quote that was, you only have three homes, and it's the planet, your brain, and your body. And I think if we can try to cultivate health and well-being in all three of those areas, in our minds, in our bodies, but also in our planet, that's where we're going to be able to achieve the greatest health and well-being, not just for ourselves, but for everybody.
Love that quote. Thank you so much for that, Sasha. And now we move on to the last but not the least, Diptika.
Well, Sacha and Stephanie have provided some beautiful tips. And to add on their points, so if you want to work on accelerating change, either with it be SDG 3 or any other SDG, just remember that you don't need to start your own organizations or your own company. You can just start your journey as a change maker, even by volunteering or working in any organizations that matches your interests, And on that case, so whenever you are working on any work that you're doing, you tend to sometimes you tend to get failures or rejections, but instead of keeping yourself down or keeping you demotivated, you keep on trying, because what I believe with my journey is that every failure is a lesson to your next victory. And on that note, take care of yourself and practice healthy lifestyle.
Thank you so much for that. Loved also as well your quote. I feel like all the speakers have given such amazing tips, and I guess now it's time to hear from you guys. So I'll pass it on to Tasia.
Okay, so we have so many interesting questions. Let's see what we have. Shall we start with Star? Can you turn on your camera and also your mic, Star?
Yeah, I'm here. So should I just read my question? I think I typed it in the chat before.
You can read it aloud.
Oh, okay. So, about mental health, I believe that in Indonesia it's still taboo, but then young people in my community have started increasing their awareness towards how important mental health and well-being is. However, this energy isn't quite mirrored by those older than us. And a personal example was that I personally suffer through mental health issues, and I have decided to come forward with my parents about needing to go to therapy once, only to be told that I was in denial and that it was all in my head and that therapy was a waste of money. And that got me to think about how do you think, how do the change makers think we as young people can reach out to everyone of all ages despite generational gaps and pre-notions from people older than us, because it's not only me, but I've heard stories from my other friends whose parents aren't that supportive, and they just said, oh no, it's a normal thing, oh you're not going through anything, you shouldn't, you're not like, they reach out only to be told that it's nothing. So, and that hinders them from getting their help, the help they need for their mental health. And I wanted to know how we can be able to contribute to a better outcome for that. So thank you so much, and super insightful discussion too.
Yay, thank you so much, Star, for your question. Sending love from Bali here to you. Now, who wants to answer Star's question first? Shall we start with Sasha?
Yeah, thank you so much for being vulnerable, Star. It takes a lot of courage to both reach out for help and also to advocate for yourself. So an amazing first step. I'm really proud of you for taking the time to do that. And I just want to encourage you that that is the right thing to do, to reach out to those around you. You deserve to feel better, and you deserve to have a good, healthy mental space. I think I can't talk about it in the context of your country, but I can talk about it in the context of young people. And I think young people really need to find a community in one another. And they need to recognize that they aren't, they aren't striving to achieve something by the standards of the generation above them, but they actually have power and agency as their own kind of like innovative, creative community. So, reaching out to those friends around you, finding solidarity in those places. I think once the upper generation starts to see that maybe the younger generation has a language or a vocabulary that they are just not familiar with yet, they're going to understand what a prevalent issue mental health is. They're going to see that it's not something that's an anomaly. It's not a here and there thing. It's something that everyone experiences and that they might have experienced themselves, but they just never were able to put the words to it. So I think really engaging older people in non-polarized, non-judgmental discussions, really trying to bring it down to a space that they can all understand. Something that I always say is, you can't understand somebody's context, you can't understand where somebody comes from, but everybody in the world knows what it feels like to feel powerless. And if you can bring it down to that understanding, I think that you might be able to find some common language. Thank you for sharing, Star.
Yay, wonderful. So we're getting tons of love here for Star. Thank you so much again for Sasha has mentioned. Now moving on, Deepika, maybe you can share a little bit your thoughts on this as well.
Yes, I totally agree with Sacha. First of all, it takes a lot of courage to share a story, so thank you for that. And as Sacha said, sometimes your parents or even the older generation do not tend to understand you. And as you said, your friends also have shared the same story. So you can reach out to your friends and talk to them about your story, and you can make a community where there's a freedom of thoughts. There's a platform where you can share your thoughts. There's a platform where you can get warm love, and where you can share all your feelings. So that is one thing that you can do that I can suggest for you.
Great. Okay, thank you so much, Sasha and Deepika, for the insightful insights. I would say Star, just like Lane also say in the comments, Star, you are the star. So keep up the positivity, and yeah. Shall we move on to the second question, Tasha?
Yes, we can go to the next question. We would like to call on Raquel to share your amazing question with us today for the speakers. You can unmute yourself and go on camera. There. Hello.
Hello. Yeah, so I have a question. You have already told us what we can do as citizens, but I was wondering if there are any organizations that we can link people to, perhaps some organization that covers treatment costs or that installs wells in communities that don't have access to water or that provide information.
Thank you so much for that question. Do any of the speakers want to answer? Maybe Dipika, since you mentioned a lot of your initiatives as well.
Raquel, which country are you from? Can I ask that?
Yeah, of course. I am from Peru, but I spent a lot of time in Sweden as well. So
based on your the place that you are located, you can do some searches on that can help you link with some of the organizations that has been working in the place that you live. And besides that, I can right now I don't have much idea about the organizations, but if I do, I'll be sending it to Utopia's team so that they can send it to you.
Thank you so much for that. And do any of our speakers want to add other opportunities, maybe resources that people can look up as well?
I don't know about your country. Maybe I've heard about the border doctors or doctorless border. I forgot the name, but you can search it on Google. Maybe because every country has their own private organizations who wants to do that. Like in my country, we have Dr. Share, but I don't know about different countries. Also, you can check out the website from your health ministry, because usually they have like a collaboration program or like a charity program with other organizations, I think.
Thank you for that. And Sasha, maybe you'd like to add. I mean, I joined Force of Nature and I'm all the way in the Philippines, so maybe this is a good opportunity as well to share.
Yeah, for sure. I can't speak to your specific context in your country, but I think definitely, getting online and looking at the Ministry of Health is a good place to start. I would say also reaching out to others who are affected in your community who are experiencing a similar problem. I think the power of community cannot be understated when you're addressing issues like this, and the voices of many are always louder than the voices of one. So finding solidarity in those around you and reaching out as a collective can be super powerful. Again, I'm sorry I can't share more specific information about your local context.
Thank you so much to all our speakers for giving your insight on that question, and I would like to now pass it on to Tassia.
Okay, thank you so much again. I think unfortunately we have to end day 3 of Unite here. Thank you so much for those of you who have participated. Also, thank you so much for Sasha, Dipika, and Stephanie. Let's give them a round of applause for this amazing discussions tonight. And before we all go, can I please request everyone to turn on their videos so that we can take a virtual screenshot? This is one of the most exciting sessions of our webinars. So yeah, keep your smile on, everybody, and our team will take pictures of ours. Thank you so much once more for those of you who participated. Thank you, Sasha, Dipika, and also Stephanie for joining us and also sharing your thoughts on SDG number 3. And we'll see you on the next one. Bye!